Hi, fellow future RNs. Today, let's talk about the basics of our respiratory system. The primary function of a respiratory system is to provide oxygen for metabolism in the tissues and to remove carbon dioxide, which is a waste product of metabolism. Our breathing is under our ANS, or the autonomic nervous system, so it's involuntary. And our respiratory control center is located in our pons and medulla oblongata, which is located naman sa ating brainstem. Okay, so these are the parts of our respiratory system, from the nose down to our diaphragm. So ang ating respiratory system is divided into two, the upper and the lower respiratory airway. So ang hangganan natin is dito sa taas ng ating trachea. From the larynx, so kasama na yung epiglottis, pataas sa ating nose, sa ating nostrils. That's your upper respiratory tract or upper respiratory airway. And from the trachea, no, pababa sa ating diaphragm, yan ang ating lower respiratory tract or the lower respiratory airway. Things to remember, no, dito sa mga parts. So, ang ating epiglottis is a flap na nagko-close once meron tayong kinain or ininom para hindi mapunta sa ating lungs. Para yung kung ano man yung kinain mo or ininom, mapunta siya sa iyong esophagus, down sa iyong digestive tract and not on the lungs. Kasi kapag nangyari yun, mag-aspirate ka. Okay? Sa ating alveoli, meron tayong tinatawag na surfactant. This surfactant is a protein, no, that reduces the surface tension in the alveoli, preventing alveolar collapse. Okay, so when we breathe in or during inhalation, no, the air travels, so mula sa ating nostrils, napapasok yung air, pupunta sa ating nasal cavity, and dito sa ating nasal cavity, or ang air na ating inhale, no, is humidified and warmed, no, and also dyan din na part ay finifilter ang air na ating in-inspire. And then the air travels pababa to the pharynx, to the larynx, to the trachea, down to our right and left main bronchus. From the bronchus, pumunta na yan sa mga sa ating lungs, no, sa bronchioles, and then sa end ng mga bronchioles, and dyan ang ating alveoli, which are the basic units of gas exchange. That's where the gas exchange happens. Okay, ang ating lungs, now is, di ba, we have right and left. Ang ating right lung is divided into three lobes, your upper, your middle, and your lower lobe. Ang ating namang left lung consists of only two lobes. And hindi lang siya visible dito sa ating illustration, but actually the right lung is bigger, no, compared to the left lung. Ang ating left lung is narrower. It's because, you know, to accommodate our heart. Kasi di ba mostly ang ating heart ay nasa left side. Okay, let's talk about the respiratory process. Okay, during inhalation, the diaphragm, so these are diaphragm, the diaphragm descends into the abdominal cavity. So nagko-contract ang ating diaphragm. That would cause the lungs to expand and magkakaroon ng negative pressure sa ating lungs. The negative pressure draws air from the area of greater pressure. So mas mataas ang pressure dito during inhalation, sa iyong atmosphere. So the negative pressure draws air from the area of greater pressure, which is your atmosphere, into the area of lesser pressure, which is the lungs. So yan ang nangyayari during inhalation. So mapupunta ngayon yung ating hiningang air containing oxygen sa ating lungs, mapunta sa ating bronchus, bronchioles, down to sa ating mga alveoli. Okay, doon sa ating alveoli, mangyayari ang gas exchange. Diba, meron kung naalala yung ating discussion ng pulmonary circulation, ang ating heart nagpa-pump ng oxygen, poor blood, papunta sa ating lungs to be oxygenated. Here is a closer look, no, sa ating alveoli. Gas exchange is facilitated by the process called diffusion. Okay, so, diba yung blood na napupunta sa ating lungs is oxygen poor blood. Ang dala ng blood na yan is carbon dioxide, no, which is a waste product of metabolism. So doon sa ating lungs during gas exchange, ang oxygen na nasa alveoli ay mapupunta dyan sa ating capillaries, and then yung carbon dioxide ay mapupunta doon sa ating alveoli, so to be exhaled out. That's the process of gas exchange. So, balikan natin yung ating respiratory process, no? So, kanina 'di ba, inhalation. Exhalation naman, babalik ang ating diaphragm. Mag-relax ang ating intercostal muscles and ang ating diaphragm. So, pag nag-relax ang ating diaphragm, that would allow our lungs to recoil. So, babalik sa dati yung ating lungs. So, ngayon, mas mataas na ang pressure sa lungs compared sa atmosphere. So, mas mababa na yung pressure sa atmosphere that would cause the air in the lungs na may kasama ng CO2 to be exhaled out of the body. So, during inhalation, pag nag-contract ang ating diaphragm, mag-expand ang ating lungs, magkakaroon ng negative pressure sa ating lungs. Now, dahil mas mataas ang pressure sa atmosphere compared sa pressure sa loob ng lungs, that would allow the lungs or that negative pressure to draw the air into the lungs. Okay, so mapupunta na yung oxygen sa lungs, and then gas exchange will happen. So ang oxygen mapupunta sa blood, ang carbon dioxide na dala ng blood ay mapupunta sa ating alveoli. Ngayon yung blood na yan na may oxygen, ibabalik yan, di ba? Babalik yan sa ating heart via your pulmonary vein, and then i-deliver na yan all throughout the body. Now, kasi ang carbon dioxide nandito na ngayon sa ating alveoli, nasa lungs na. So, kapag nag-exhale tayo, kasi ang ating diaphragm bumabalik sa dati na nagre-relax ang ating diaphragm, that would allow the lung to recoil. So, babalik sa dati ang lungs. Kapag nangyari yan, mas mataas na ang pressure sa lungs compared sa iyong atmosphere. That would allow ngayon yung ating air sa ating lungs or the carbon dioxide sa ating lungs to be exhaled out of the body. So that's it for our respiratory system and the respiratory process. I hope you learned something today. Bye.